This adorable little boy is Nicholas Rizzo. In June, we told you how he was stuck in the hospital until the state-assigned home care nurse could take care of him. That took months, and while the one-year-old is smiling at home now, the struggle to find care isn't over. CBS 2's Lauren Victory looks at solutions the state is trying to implement.
Untangle, untangle.
Nicholas Rizzo spent months in a hospital crib waiting for a home care nurse to take his case so he could make memories like this with his brothers at their house in Montgomery.
We were able to bring him home in October.
That's Kathleen Flynn with Aviana Healthcare, a nursing agency that looked for someone to help the Rizzo family.
We were so excited.
Flynn's reaction when the Rizzos wound up finding some help on their own by circulating flyers like these.
A family can post all of the little intricate details about their child on Facebook that a company cannot do.
Nicholas's family also shared this website with us. They don't have full nursing coverage right now, so the hunt continues. Sarah Weston's mother, Amy, is also constantly recruiting.
You want to come work for a really cute little 7-year-old? Because we've got lots of openings.
Illinois Department of Health Care and Family Services says it would pay for Sarah to receive in-home shift nursing.
She's allotted 16 hours a day of RN care.
But it's Mom,
all the initials are mine,
who winds up covering most of those hours unpaid.
These are all the medical supplies Sarah uses, another way to visualize how consuming her care is. Unfortunately, being shorted on in-home help is nothing new.
We had families reaching out to us who were saying, I just don't have my nursing shifts filled.
Carrie Chapman from Legal Counsel for Health Justice helped exhausted parents file a class action lawsuit against the Illinois Department of Health Care and Family Services back in 2015.
Under the Federal Medicaid Act, the state needs to ensure that these kids get care and to ensure that the kids are not at risk of institutionalization. And we alleged that the state was failing to meet its obligation.
The lawsuit ended with this 2019 agreement. The state did not admit fault, but pledged to revise processes for providing in-home nursing services. Progress reports were required. CBS 2 obtained them through an open records request and made an interesting discovery. Between April 2020 and April 2023, home care families' satisfaction rate with staffing dropped. What rose? The percentage of cases marked no nurse applicants. It's a trend the state appears to be aware of, telling CBS 2 it's committed to helping kids like Sarah. One of its solutions to the staffing shortage, rate increases for in-home nurses. A $9 an hour bump went into effect on January 1st of this year.
It has been a kind of a common theme with us families that it's disappointing.
Disappointing because the rate increase, bringing registered nurses to $54 an hour, doesn't all wind up in caregivers' pockets. Part of that pay flows back to nursing agencies that staff cases.
When you do get a rate increase, it covers everything. It covers the training that goes into it. It covers the recruiting. It covers the supervisors.
CBS News Chicago reached out to more than 60 Illinois nursing agencies that provide care for medically complex children. We asked what they're offering new hires with the new rate now in effect. Only a few responded, telling us $40 an hour, not $54, is the best they can do. A $14 spread helps them break even.
I understand they have overhead costs. I understand that they have to be able to keep their business afloat.
Still, the Westons, Rizzos, and hundreds of other families are asking that the state begin restricting the amount of money that nursing agencies can take so more goes home with home care providers.
Good girl.
For now, the data doesn't lie. Parents are exhausted from filling in as nurses, not unlike the sentiment that spurred a lawsuit almost 10 years ago. Lauren Victory, CBS 2 News.
CBS 2 never heard back on our request for a sit-down interview with the new director of the Illinois Department of Health Care and Family Services. A spokesperson did email us about some improvements in the work. We put that information on cbschicago.com. Now, the state said it supports federal proposals to implement a minimum hourly rate for caregivers.